Your pet has just undergone a surgical procedure, and it is now important to understand how to best care for your dog or cat when they go home. It is critical that you closely follow your veterinarian's instructions in order to provide the best surgical aftercare for your pet. In the next few minutes, we will look at what you can do to help your pet's recovery. A patient's complete recovery from anesthesia may take 12 to 24 hours, while recovery from the actual surgery can take days or even weeks. Pets that have undergone basic surgical procedures, such as a spay or neuter, are generally back to acting normal within 1 to 4 days. It is important to remember, however, that the body and tissues continue to heal and strengthen for 2 or more weeks. We should adjust our pet's activities and lifestyle during this period to allow for a complete recovery. As with any surgery, the key to a quick and uneventful recovery is to take it slow, follow all of your veterinarian's instructions, and provide lots of loving care. You will be your pet's nurse for the first few days after surgery. When you pick up your pet from the hospital, they will likely be a bit groggy from the anesthesia or pain medication. After the veterinary staff has gone over your instructions and medications, you will be ready to transport your pet home. This is best accomplished with a travel crate that is padded down with a towel or blanket. Smaller pets may be wrapped in a towel and carried if you prefer. Your pet will be very excited to see you, but you'll want to minimize them from getting too worked up. Upon arriving home, prepare a clean, warm area for them to rest. When your pet is fully awake from the effects of anesthesia, it is okay to offer him or her a small amount of water unless directed differently by your veterinarian. Avoid offering large amounts of water, as your pet may drink too fast and become nauseous. A good way to limit water consumption is to offer an ice cube for your pet to lick on. This can help to soothe the throat while also keeping him or her well hydrated. Depending on the surgical procedure, it is normally acceptable to offer your pet a small amount of food the evening of the surgery. You can feed your dog or cat 1/4 of their usual portion 3 to 4 hours after returning home, provided she has been able to keep water down. If your pet does not show interest in eating that first day, don't be alarmed. Simply offer small quantities of tasty diet the following morning, and most dogs and cats will resume feeding. If your pet continues to show no interest in eating, contact your veterinarian immediately. Rest and relaxation are important features to your pet's recovery. Rough play, daily walks, running, and other physical activities should not be permitted. These behaviors can cause your pet's sutures to tear out or may slow the healing process. Be sure to keep other pets and children from bothering a dog or cat that is recovering from surgery. Regular walks with a leash may be resumed after 7 days following minor surgical procedures. Most pets will have sutures after they have undergone surgery. These sutures will either be beneath the skin and dissolve on their own, or they will be external and need to be removed 10 to 14 days after the surgery. It will be important for you to closely observe the sutured area for any excessive redness or inflammation. Your veterinarian may even recommend that you clean this area periodically with warm water or hydrogen peroxide. Some pets are sent home with Elizabethan collars. This lampshade-like collar is used to prevent the dog or cat from chewing or scratching at the surgical site. If you do not have an Elizabethan collar and your pet begins to chew at their sutures, you should contact your veterinary hospital about getting one fit for your pet. This collar can be temporarily removed when your pet is feeding or closely supervised. Bad-tasting prescription topical creams and sprays are also used around the surgical site to help deter your pet from bothering this area. Pets should not be bathed until the sutures are removed. This is especially important for the first 7 days after surgery. Keeping your pet inside during the recovery period will help to keep the incision area clean and also help to minimize excessive activity. It is especially important to keep the litter box clean when a cat is recovering from surgery. Be sure to closely monitor your pet's urine and stool. If diarrhea, constipation, difficulty urinating, or other abnormal symptoms are seen, contact your veterinarian. Cats that have had a declaw procedure should be provided with shredded paper or another soft, non-granular lining in their litter box for 7 days. Depending on the surgical procedure, your veterinarian may send home pain medications or other prescription drugs, including antibiotics. It will be important to closely follow your veterinarian's directions when giving these drugs. When antibiotics are prescribed, it is extremely important that they are given to completion. Your compliance with the post-operative instructions provided by your veterinarian is paramount to a smooth recovery and successful surgical procedure. Remember to always contact your veterinarian if you have any questions or concerns about your pet's recovery. If your veterinarian is not available, familiarize yourself with the area's local emergency pet clinic if one is available. Your attentive and loving care is a pet's best insurance for a smooth surgical recovery.